Fractures in foxes. What is a fracture? A fracture is a break of the bone or cartilage, often called broken bones. The bone can be completely or partially fractured in many ways: crossways, lengthways, several places, or in many pieces. Most fractures occur due to force or pressure in which a bone cannot support. Types of fractures. There are many different types of fractures. This is showing the most common ones that can be seen. So you've got a closed fracture. The bone may be cracked, but the skin is not broken. The area can be affected by swelling, inability to move the limb, and whimpering. The next type of fracture is a green stick fracture. The bone is cracked but not completely swollen. Broken, The area can be affected by the swelling or limping. Thirdly, you have compound fracture. This type of fracture can be dangerous as the bone penetrates the skin. This puts the fox at high risk of infection as bacteria can easily enter the open wound. And then finally, you got the epiphyseal fracture. This type of fracture is most common in young foxes as the bones are still growing. This type of fracture happens on the soft area of the bone known as growth plates. This can affect the growth within the leg, making it shorter due to damaged growth plates. Signs and symptoms. Signs that a fox may have a fracture is that it may limp, the limb may be at an odd angle, and the movement of range is wider than it should be. A grinding sound can be heard as the end of the bones rub together. The fox can show pain at the site of injury. If a fox has injured their legs, they may hold their leg off the ground. It should be monitored how the fox uses the legs and how the leg is moved. Causes. There are many different types of causes of fracture. However, the two most common ones can be seen as car accidents or falling from heights. First aid treatment. When doing first aid treatment, never attempt to capture a fox by yourself, as scared foxes can often bite. It is best to contact a rescue centre, who will commonly ask you to approach the fox to see if the fox will get up and run away. If the fox remains still or moves away slowly and impaired, then observe where the fox goes. This can help the rescuers determine where to collect the fox from. If the fox is able to move away, the rescue team may set up a trap to contain the fox safely, as trying to catch a fox while it is mobile can cause more stress to the fox. Veterinary treatment. The vet will start by doing an X-ray in which the fox will be put under a general anaesthetic to prevent movement and determine the severity of the fracture. Fractures can be stabilised in a variety of ways, but the veterinary surgeon must take into consideration what age they believe the fox is to determine how to stabilise this fracture. If a fracture is simple and minimally displaced, then the cast may be better. If the fox is young, then it may need to be changed periodically to grow with the fox. Another method is the external fracture, in which pins will be placed through the skin into the bone. This method prevents the bone from moving and allows for the bone to heal. This method is also minimally invasive. To determine if surgery is needed for a fox, fox's age, area of fracture, if the skin is intact, fragments of the bone, and if the fox has any orthopedic issues, needs to be taken into consideration. Surgical repair often involves bone plates to realign the bone. Recovery. It is stated that a fracture will take between 8 to 12 weeks to heal, and whether it's a cast, external fractures, or a bone plate. Foxes will often be taken to a rehabilitation facility to heal, and then when the fox is okay and better again, they will then be released back into the wild. And that is the end of the video. All references can be found on this page, and thank you very much, and I hope you enjoyed.